Okay, so here we are at EBMT in 2019 in Frankfurt. What's the news? Well, the big thing is really where do CAR T cells fit in? Now, as we're talking about mantle cell lymphoma, what are the current standards of care? And I had the honor to discuss the results on transplant as well as targeted therapy. What's the role in first-line treatment? Well, so far for younger patients, autologous transplant is standard of care. What is this based on? Well, essentially there's exactly one trial, and we provided some long-term follow-up. The full data set will be presented in Lugano. And what I can tell you is, in fact, yes, there is an ongoing benefit on PFS. The full data set will be presented as said in Lugano, so let's say data on overall survival are promising. So how can we squeeze in the new targeted approaches? Well, there are the famous Beatles, which are, the short names of the registered compounds, bortezomib, ibrutinib, temsirolimus, lenalidomide. Where's their role? Well, we now have new data for bortezomib in combination with chemo. That means for induction treatment, if you're going for CHOP, instead you should choose VRCAP, which is bortezomib, substituting for vincristine, even increasing overall survival of a long-term follow-up. Second thing, what about lenalidomide? We have data on essentially maintenance after autologous transplant by the Italian group. And they again showed a significant improvement of PFS, hazard ratio 0.5, meaning by lenalidomide maintenance you reduce relapses by 50%. Quite impressive. And finally, we have ibrutinib, which is probably the front runner of targeted therapies. And what we know now, we are currently performing a European trial in 10 European countries so far recruiting. We still miss Great Britain. But anyway, what we have achieved so far after recruiting 400 patients, we know it's feasible. And this will be a very interesting trial because that's the first one cutting down chemotherapy, well, essentially autologous transplant. So this will be also including a head-to-head comparison, targeted therapy versus autologous transplant. What about the other options? Allotransplant, I think it's quick to summarize. For first-line treatment, no. For relapse, definitely this still remains an option for young patients. And what about CAR T cells? Well, we don't have any data. We only have, case reports. Looks promising, but these trials are running, and if you ask me, this is the patients especially prone for this approach are the high-risk patients. What does it mean, high risk? It's P53 mutations, Ki67 about 30%, or blast variant.